Greetings and welcome to Brock Safety Consultants AED Sales and Service broadcast about heart attacks. My name is Steve Brock. I'm a paramedic. I'm also an advanced cardiac life support instructor. I'm also a basic life support instructor. A little bit about myself in order to let you know who this is coming from. Myself and others teach doctors, nurses in advanced cardiac life support. The advanced cardiac life support that paramedics deliver on the scene of an emergency is the same advanced cardiac life support that doctors and nurses deliver at a hospital, at an emergency department. You may have someone who suffers from a cardiac arrest or a heart attack at your home, and you wonder why are the paramedics taking so long here at the scene instead of rushing to the hospital? As I mentioned, the advanced cardiac life support that we as paramedics provide is the same advanced cardiac life support that they will get in the emergency department. The difference is in when we're on the scene and we take time to give the medications, the same ones the doctors and nurses would provide, do the same therapy that doctors and nurses would provide, we are doing so in a controlled environment rather than expediting down the road where it's more rather uncontrolled. We may have to start an IV. We may have to give medications down that IV. If you've ever seen the port to an IV and we have to stick a needle in that, it's very dangerous, especially if we're driving down the road at a high rate of speed with lights and sirens going. What I'd like to talk to you about today, as I mentioned, are heart attacks. Now, when someone says heart attack, you might think, what's the difference between a heart attack and sudden cardiac arrest? A heart attack, also known as a myocardial infarction, the myocardium being the muscle of the heart, and the infarct. I will explain about an infarct because I know it sounds like a pretty technical term. It's whenever a portion of the heart fails to receive the blood, the oxygenated blood, that it should receive. One might get chest pain. One might become sweaty. One might have nausea, vomiting. There's so many symptoms of myocardial infarction or a heart attack. The key factor is we don't want to delay as citizens, as laypersons, to get care, to get 911 emergency care to that victim. One of the biggest factors when it comes to heart attack is that a lot of times, many times, the biggest thing about heart attacks, for lack of better terms, is denial. Denial by the patient, denial by the family. Oh, not me. I don't have a heart attack. I'm in good shape. I went to my doctor just not very long ago, and they said that my heart was in good shape. Heart attacks can occur suddenly without any signs or symptoms whatsoever. And dependent on the portion of the heart that is blocked from receiving that oxygenated blood, depends on the severity of the death of that myocardial infarction. So if you've got a small portion of the heart being fed by that vessel, by that oxygenated blood, chances are you may only suffer a little pain. And you sit down, you subside, pain subsides, and goes away. Not a good thing always. That should alert you that there is a problem. That should alert you that there is part of that heart, a part of that heart muscle, the myocardium, being deprived of oxygenated blood. If a large portion of the heart is affected, it usually results in death. That's why we can't wait. You might have heard it said, time is muscle. Call 911 right away if you ever suspect it. Remember, that victim is probably going to deny that they're having a heart attack. So let's stop and look at it. Maybe you might know somebody that was mowing their grass and had a heart attack, or started having chest pain and went in and sat down, and the pain went away. At that time, their heart's not demanding as much oxygen as it normally would if they were resting. What about those of us that go out and shovel snow in the wintertime? We start having chest pain while we're out there working. We're denying it. We're putting it off. And we're delaying therapy and care. We finally go in, we sit down, rest, and the pain goes away. Well, when we're resting, we don't require as much oxygen. That pain should alert us that there is a problem. Again, as I mentioned, a heart attack is a result of a blockage of the vessel which feeds the heart with oxygenated blood. Time is of the essence. Time is muscle, just like we've said before. Call 911 right away. Get the patient to rest, relax. Perhaps they may take a medication known as nitroglycerin, which they put under their tongue and it dissolves. Maybe that takes the pain away. If so, they should still be evaluated. Something's going on. As we mentioned, when someone's resting and relaxing, they don't require as much oxygenated blood as if they were working and demanding. One thing you really need to be cautious of, if that pain awakens someone in the night, that usually indicates that they are having a heart attack because they're resting during that time. That pain comes on when they need little oxygen, but there's severity and it's blocking that heart from getting the oxygen that it needs. So, what are some signs and symptoms of chest pain? Now, chest pain is often known as angina or angina pectoris. It's an issue when someone has a heart condition. The older we get, the more heart disease is able to affect us. Causes of heart disease include sedentary lifestyles, failing to be active, fatty, high cholesterol foods, let's see, family history, smoking, alcohol, diabetes. So what does this chest pain often feel like? What are the how may someone describe the chest pain? They may describe it as a discomfort. They may describe it as a crushing pain. They may describe it, and I've often seen this as a paramedic, as someone standing on my chest. Maybe described as crushing, maybe described as heaviness, or on occasion, they may not have any pain at all. The heart attack can occur suddenly. Now, the difference between a heart attack and sudden cardiac arrest is the heart attack does not always result, however, may and very well can result in cardiac arrest. So the cardiac arrest is when your heart stops beating, patient becomes unresponsive, and they aren't able to breathe. Heart attack is when somebody starts having that chest pain, portion of the heart dies. They have difficulty breathing. They often break out in a sweat. Again, they're often nauseated and maybe even vomiting. They have anxiety. They may have dizziness, and they may describe the pain as indigestion or heartburn. What are some of the things that we can control or not control when it comes to heart disease? Well, one of the biggest things related to heart disease is our age. When men reach the age of 45, they become more susceptible to heart disease. When women reach the age of 50, they become more susceptible to heart disease. Again, we mentioned our lifestyle. Well, we can become more active. Now, I will caution you that it's a very good idea to see your doctor, see your physician prior to starting any exercise program. You don't want to already have that damage and then something occurred or occurs because of your exertion of your body, which can lead to a heart attack. So see your physician first. Another question might be, are you on any cardiac medications? And there's a number of those, and we'll review them as we go on it at another time and episode. Family history. I know myself, my father, my grandmother, several of my ancestors had heart disease, and that makes me susceptible as well. Fortunately, I have a good controlled blood pressure. I've passed a stress test. So try to keep up on what you can do to prevent a heart attack. Remember, you only have one heart. Let's take care of it. Lifestyle. We mentioned lifestyle. We mentioned the sedentary lifestyle. Again, become active. We mentioned smoking. If you smoke, quit immediately. Smoking can fill your lungs and fill these vessels with bad particles that can lead to buildup of plaque or cholesterol within your vessels, leading to a heart attack. Your diet. I certainly encourage everyone, especially if you're a diabetic, to take a class from a dietitian. I know I personally have myself. Smoking, we mentioned that. Alcohol and drug abuse or substance abuse of any kind. Alcohol very commonly leads to heart attacks. Drugs, substance abuse, toxic for your body. Try to get help and get therapy for that. Again, I'm Steve Brock, paramedic, advanced and basic cardiac life support instructor with Brock Safety Consultants, AED Sales and Service. We invite you to subscribe to our YouTube channel. You'll see a little red box down there in the right-hand corner of your screen. You can also reach us at www.brocksafetyconsultants.com. You can also follow us on LinkedIn at Brock Safety Consultants, AED Sales and Service. You can also follow us on Facebook. We encourage you to follow us on our social media networks because we are often releasing public information that just might save your life. We also invite you to contact us via telephone, 765-792-0365. I'll give you that number again. It's 765-792-0365. Please reach out to us. If you have any questions, we'll be glad to answer them for you. If you're in need of an AED or any health or medical supplies, we are your answer. We are Indiana's largest distributor of AEDs. The paramedics that work for us also teach CPR, first aid, and other disciplines, a wide array of disciplines. If your work, your church, you as yourself, maybe a home health care provider or something, need a CPR class, AED class, please feel free to give us a call. Remember, the life you save may be your own. At Brock Safety Consultants, we're saving lives one heartbeat at a time. Thank you so much for your time.